All right, so welcome everyone to NMatch's first adult neurology PD panel of the year. Thank you all so much for being here on a Monday night. We have some great programming for you today. My name is Alyssa. I'm one of the NMatch leaders on the team this year. I go to AT Still University School of Osteopathic Medicine in Arizona.
Hi everyone, I'm Meghna. I'm also an NMatch leader and I go to the Texas College of Osteopathic Medicine.
So just a quick overview of how our call is going to go today. We're going to do some brief introductions, and then each of our three PDs today are going to give an overview of their program, and then we're going to just open it up to a Q&A for all of the participants.
And we just wanted to give a little overview of what NMatch is for those who might not be familiar with our organization. But we are a student-run initiative and we were founded during the residency cycle of 2020 to 2021. Sorry if you can hear dogs in the background. But basically what we do is a lot of online networking and education, as well as sharing information within the neurology community. And some of our initiatives, if you've seen on our social media, is the mentorship program. We have an event calendar on Instagram. On the links you can see and add our calendar, and then we have program features and educational panels like this one, which are going to include resident panels, mock interviews, a lot of these types of things throughout the rest of the semester and the year.
So our panelists today are all coming from the East Coast. We have Dr. Alex Dalrymple from the University of Virginia in Charlottesville, Virginia. We have Dr. Erica Schuyler from the University of Connecticut in Hartford, Connecticut. And then we have Dr. Colleen Tomcik from the University of Rochester in New York. So Dr. Dalrymple, you can take it away.
Sure. So thanks for having me. I really appreciate the invite for this, and thank you everyone for being here. Really excited to share a little bit about UVA. I have a few slides, but really they're not that important. It's just kind of like, look, this is our hospital. This is who we are. I can introduce you. So Dr. Shumei Huang is our department chair. She just finished her first full year as our department chair. That's me there in the middle. Sorry, you have to look at my face again, but I'm the residency program director. I'm in my third year of program director now. I've been at UVA for about a decade, so I actually matched at UVA for my own residency and wound up staying. And then my close friend and colleague, Dr. Catherine Sixies, is our child neurology program director. We have a very close relationship with our child neurology residency as well. And we've been a residency program for a long time. So last year was actually our 65th consecutive anniversary of continued program accreditation, which I think is pretty cool. And then we have I'm really lucky to have two awesome associate program directors, Alyssa Higginbotham, who's a movement disorders neurologist just like me, and then Jose Posas, who's a sports neurologist. He's actually a previous program director himself down at Oxnard in New Orleans, but he moved to Charlottesville. He saw the light a little while ago and has been on our team for over a year now. Um, Again, I don't mean to belabor all this, but we firmly believe in graduated autonomy. What that means, and I promise this will not be the last time you hear that phrase throughout all of the interview season, but really all that means is that as you progress through residency, right, you go from being supervised to being the supervisor. And honestly, the rest of the slides you can read them. I don't need to go over them. I'm really more here for the Q&A stuff. I'm happy to go through them. We have 7 residents a year, two pediatric neurology residents a year. And frankly, it's the cool thing about our program is that all of the rotations are at one hospital. We don't have a VA, we don't have satellite clinics, so you get to know your co-residents, you get to know the residents in other specialties really well. And Charlottesville, in my highly unbiased opinion, is a great place to live. That's all I got.
All right, we'll move on to Dr. Schuyler.
All right, looks like I'm up. So I just wanted to welcome you all. I see a lot of people logged in, almost 100 participants. It's really exciting. It makes me so excited about this upcoming recruitment. I didn't send my program slides. I'll give a plug for our program open house, which is a week from tonight. So I encourage anyone who's interested in hearing all the details from our program leadership, a bunch of faculty and a bunch of our residents will all be logged into Zoom next Monday night to go through some details of our program and answer program specific questions. Also, if we have any IMG applicants in the session today, we recorded our annual webinar, which is specifically designed to provide additional guidance to IMG applicants in neurology. And we did that, I think it was August 7th was the date of the live webinar. We did record it. It should be up on our UConn Neurology YouTube channel soon. You can see the past, we've been doing them since 2021. And so I feel free to look at any of our previous years. Hopefully we provide a lot of good guidance for our IMG applicants to neurology residency. I know that there's some additional things that are really helpful to know coming from that standpoint as opposed to applying as a US based applicant. So I'm just going to take a couple minutes and just kind of do a big picture kind of advice, I guess, and then I'm looking forward to the Q&A. So in terms of the virtual recruitment, I know it's kind of weird still that, the pandemic has ended, yet we are still doing our interviewing basically almost all online. There are some programs doing some in-person second look activities. I wanted to reassure you that the process in doing this on Zoom actually really works very well. Having done this for 4 years now, somehow we've managed to, recruit and get like amazing residents that are a wonderful fit. And we're really able to really do this process really well online. I was worried about it back in 2021 when we did the first year, but it's really worked out so well. And I think just in terms of having people applying from all over the world, it really, from an equity stake, is not realistic for all applicants to really be able to travel both logistically and financially to visit all these programs that you really are interested in. So I think doing this in the virtual environment really kind of levels the playing field and gives the opportunity to really meet and get to know, and actually you can really connect with somebody in a Zoom interview. So I just wanted to be reassuring about that. The other thing I wanted to reassure the group about before we get into all the QA and stuff like that, and to give Colleen a chance to talk about her program and stuff, is really just that the people that are reviewing your applications and interviewing you, we're all, really excited about it. So we're all, the programs across the US that you're looking at right now are universally extremely high quality. How do I know that? So in my experience as being a program director now, I'm really old. I've been a program director of this program for just over 16 years. And in the last 10 years, some of the things I've done are to be kind of the chair of our big group of all the program directors. So through the AAN, we have a group of all of us. It's called the Consortium of Neurology Program Directors. I was an officer, including a chair of that organization for 6 years, and really got to know a lot of our programs very well. We collaborate on a lot of curricular elements. We meet several times a year. We have a lot of online communication, and I can tell you that for that reason, the programs are such high quality. So you really can't go wrong. It really comes down to which programs you really feel like, based on where your family is from, where your friends live, where your colleagues are, geographic preference. If there are certain departments that have, highly developed divisions in an area that you may be really interested in potentially for fellowship, there are certain things that you're going to be looking for potentially that are really going to make a program a better fit. But in terms of the quality of the education you are going to get in those 4 years, going in one side and coming out the other, an independent general neurologist ready for autonomous practice, you are going to achieve that outcome. So I just wanted to reassure you all of that. I think it's really important to know that these programs, this isn't a competition between us. This is really about figuring out where you want to live, who are the colleagues that you feel like you really mesh well with, what may be a geographic area that you have a certain connection to or may want to settle in later after you finish training. So there are a lot of decisions that are very personal for you to be making. And our goal is really, as programs, to kind of show the best we can what we're like. And obviously you're only getting a cross section, but really to display and give you opportunities to interface with our residents, with our faculty, and to answer as many questions as you may have, so you can really figure out which is the best fit for you. And then I wanted to also mention a couple other things. One is that there are guidelines that the AAN has put together. So we had a work group. We first formed our work group back in the first year of the pandemic, and really set some guidelines in terms of how virtual recruitment, just sort of basic guidelines for programs and for applicants. That has been reviewed and revised every single year. The current revision is going to be coming out sometime in the next, I think, week or two. And it really is not much different from previous years. So I encourage you to look at that. I encourage you to also look at the data in terms of when you're thinking about how many programs should I apply to, what are my chances of matching based on what type of applicant I'm applying as, and just to really educate yourself on sort of what are the data, what is the and what is the match rate like, and just to learn about ERAS and NRMP and how that works and how the match works. I think the more you learn about that stuff, the less anxiety you're potentially going to have going into the process. And then I think that's pretty much all I'm going to mention now, and I'll save the rest of guidance for questions that you all have. But just so you know, these programs are full of just amazing residents. All of us meet a whole bunch of them every year when we do interviews. We only match a few of them. I have 7 per year. You just heard Alex has 7 per year. But we meet 100 of you. So at least I'm saying, on average, we're interviewing probably about 100 per program. I don't know. But, it's amazing to see just kind of the, just how impressive all of you are, all the things you've done, and it's really exciting to know that that is the future of our specialty. And so I think as program directors, I don't want you all to go into this process feeling like, you're intimidated by us or anything like that. The program directors and faculty you're going to be meeting are, yes, a lot of us are very experienced medical educator faculty, but we love doing this. And so, our goal and our career satisfaction comes from training the next generation of neurologists. So I just, if you kind of go into it with that mindset and just know how much we want to meet you and kind of get to know you and see who's the best fit for us, but just to kind of, reassure you that, we're very excited, and we're normal human beings on the other end of the Zoom interview. So just to set the stage there, and that's all I'm going to say unless there's any specific questions afterwards. So thank you.
Thank you, Dr. Schuyler, for your words of encouragement. We're going to move on to Dr. Tomcik now, and then we'll go on to the Q&A.
Okay, so hi everybody. Greetings from the Finger Lakes region of Western New York. Nothing beats summer in the Finger Lakes, except for perhaps fall in the Finger Lakes, which is when all of Western New York becomes a real life Hallmark movie, especially when the Bills are winning, and they usually are. So go Bills. And without further ado, I won't belabor our specific slides. We do have a virtual open house coming up on September 10th for anybody who's interested in our program. But what I like to end always with, I guess you can go back, is what we value in a neurology resident. And I think I speak for Dr. Schuyler and Dr. Dalrymple. We really want people who are intellectually curious, motivated. We really want to know why you want neurology and why you're interested in our program. So we really want you to be authentic in your application, on your interview trail. Don't tell us what you think we want to hear. We really want to know who you are and what makes you tick and how we can help support you through the process and how our specific program meets the needs, for you professionally and personally. So at University of Rochester, we have the I care values that I hold all of our residents to. I add another C for curiosity because I think that's a really good skill for a resident to have. But you will find even more so than when you were in undergrad or in medical school, when you become a resident at whatever program, you really do become part of something bigger. You really do become part of a family. And it's really important to find that fit and feel like you are surrounded by people who are there for you, who feel like kind of your community. And so that's really important that it's a mutual respect between us and you. And I'm just here for the Q&A. So let's get into it.
All right, so without further ado, we will start the Q&A. So participants, how we're gonna go about this is if you guys have questions, if you could put them in the chat, and then me and Megna are gonna go through and say the questions out loud on behalf of you guys. If there are any questions that you see in the chat and you really resonate with, or you really want that question to be answered, if you could go ahead and heart or like that message so we can really target those questions that have more reacts to them, that'll really help us kind of filter those questions that you really want to get answered. So we'll go ahead and you guys can use the chat to ask any questions you'd like. All right, so our first question has come in, and they're asking for all three of the programs, what is the patient population like? Is there exposure to complex and diverse cases that you would see in bigger cities like Philly or New York?
I can go first, I guess. So we're in Charlottesville, Virginia, which is not a big city, decidedly not a big city. But we, as UVA, kind of the flagship institution in the state of Virginia, we draw from literally the entire state. So it's not uncommon that I'll have patients, in a clinic afternoon, where I'll have one patient who lives walking distance to the hospital, and another one who drove 4.5 hours one way just to see me, and then is there for the 30-minute visit and is driving 4.5 hours back. So I think we have a good balance here at UVA between sort of the bread and butter, basic epilepsy, neuropathy cases, and then a lot of the zebras or even unicorns that you would see at bigger academic centers.
Yeah, I'll speak for Hartford in that Hartford, Connecticut is not a big city either. However, we have a huge hospital there. So the hospital's over 900 beds, comprehensive stroke center, surgical epilepsy center. We have 2 neurocritical care units. It's a huge hospital. They're in the process of building another tower, which part of will be a neuroscience tower. And the number of beds at Hartford Hospital is going to go up to close to 1,200 over the next 8 years. So it's a huge hospital. So I mean, you name it, we see it pretty much, at least once a day. So I think, just if you're kind of looking, it's important to look at the hospital, like where you're going to be rotating primarily as a resident. It may be that, so I did some of my training in Baltimore. There were like 10 teaching hospitals there. If you think of Boston, there's a ton of teaching hospitals in Boston. So as opposed to, you take the state of Connecticut, there's 2 big hospitals. There's us and Yale. So, there's 2 big teaching hospitals essentially for the entire state. So, kind of thinking about it that way.
And I will speak for Rochester. So, for any of you familiar with the state of New York, it is actually quite large. We are the major referral center between New York City and Boston and Cleveland. So we have a huge catchment area. We're the #1 hospital in upstate and Western New York. So we bring, we're the only cardiac transplant in upstate. We have a huge cancer presence. We have a comprehensive stroke center. So we have all of the big city neurology, but we are also one of the hometown hospitals. So, Strong is very much committed to caring for the community. So we see people from the greater Rochester area for straightforward things like sprained ankles and sore throats, but we also are the quaternary referral center for things like transplant, cancer, neurologic care. We have a huge teleneurology and telestroke presence. Many of those patients end up coming here. And we also have a huge catchment area for outpatient neurology. So, even though we are a smaller city, we have less of the hassles of the big city, but all of the big city neurology. So, there's not any lack of neurology here in Rochester.
Awesome. Thank you for your answers. I'm going to skip down to a question that's already gotten quite a few reactions. How much do your programs factor in signals for deciding an interview?
All right, I can take on the signals first if you want. So I think there are, there are over 170 adult neurology programs at this point. And if you ask every program director exactly how they use their signals, they're probably going to get a different answer. So it really depends on sort of the economics or the supply and demand of a certain program. So what I would suggest to you, in terms of the signals, you have 8 signals. If you're applying in adult neurology, you can also have the option of selecting a geographic preference. My recommendation is to not try to game the system, and that this is the time for you to pick what are those 8 programs that you really, really want to know that you're interested. And that's really what it's meant for. And I think some, programs use it differently. So if you're a program that, let's say, gets 1,200 or 1,300, I don't know how many are the total number of applicants. If every single applicant applies to the same program and they get 500 signals, if you're the program director, are you going to look at the ones that didn't signal you? If you have 500 applications, you know what I mean? So it really, it's kind of depends on sort of the ratio, and does the program receive enough signals to solely base their interview selection from that cohort. There are some program directors that will tell you straight out that because they feel that they have such a reputable program that anyone receiving an interview offer, would be happy to come there, then those programs may be ones that say, we don't even look at your signals at all. We holistically review every single application and pick our top 100 out of that whole group. I think probably the typical program is looking at signals favorably, because that's the whole idea. We really are using that as a way of knowing that someone's really interested in our program. So I think that, like I said, my advice is really to use this time now to really research the programs up front, to decide what those 8 programs are that you really, really want the program to see, okay, this is somebody that's like really serious, really, really wants an interview with my program. The same thing with the geographic preference. In terms of, and I saw that that's a question too, so I'll hit that one too. The geographic preference, if you have one, then state that as a geographic preference. If you don't, then select no preference. I think it's really hard to try to game the system with that also. A lot of times applicants will put a little note if there's a reason for that particular preference, like my entire family lives in New England. I really want to, I'd really love to train there so I can be close to them, etc. And likewise, if you really don't have a geographic preference, if you feel like you could move anywhere in the US, you just want to find the program that is really the best place for you, then just put no preference. And a lot of times people will put a little note there saying, I'm just looking for the best program to train at. I will move anywhere. I really do not have a preference in terms of where I would want to live. I just, so I think, just to address that one too. So.
And I would agree. We look at signals along with every single other aspect of your application. We look at them favorably. It's not going to be the only thing that we look at and say, well, they signaled us, so we're automatically going to give you an interview, or they did not signal us, so we're automatically not going to give you an interview. But I think it's really more for you to put out there what you're looking for in a program, so that we can really take an even more critical eye to your application and say, okay, what about this person's application screams University of Rochester to us? So kind of why would they signal us? And then we can kind of help, make a decision from there. With the geographic preference, again, I think it's nice if you have one. The only thing I would caution you is don't be super specific unless you want to be, because a lot of times, again, New York is a big state. We are in the Middle Atlantic division, as my son would say, but we are very far away from New York City and Philly, who are also in our division. So if you say in your geographic preference, I would like to be within 2 hours of my family in New Jersey, that's going to make it hard for us to say, wow, would they really want to come here for training if they feel that strongly about being that close to their family? And we know that we're already outside of that radius. So if that is something that's very important to you, again, I think it's about doing your research on these programs ahead of time. If that's really a deal breaker for you, then I'm not sure you should apply to University of Rochester if you don't want to go, be that far from your family, which is perfectly fine. So just be careful not to kind of say so much that you actually, make it seem to programs like, oh, I'm not sure if they would want to come here because they're being very specific in their geographic preference. But again, for our program, we look at it as one, just one more piece of the whole puzzle, trying to get to know you as an applicant.
And then I have very little to add to that. I agree with essentially everything they said. I want to echo Dr. Schuyler's point of not trying to game the system. I even our UVA medical students, whenever I'm advising them on applying to neurology residency, I say, look, don't worry about is this the right tier to be signaling. Literally, just pick the 8 programs that you're most interested in and send your signals there. The only other thing that I'll add, I think, and this is just me speaking for me. I don't pretend to speak for anyone else, but in my mind, I see the individual program signals as kind of stronger or a higher tier than the geographic preference. So I saw a question on here while we were discussing this that asked, what happens if I signal a program that's not in the geographic region that I have a preference for? I'd probably value the signal over the geographic preference, if that makes sense. But yeah, otherwise, I agree with everything they said.
All right, thank you, everyone. I would also just like to add as an applicant, if anyone has not seen the AAMC Residency Explorer tool, please make use of that. They also have just more data, more information for you to use, including signaling information. So you can see the percentage of applicants that are offered an interview if they do signal. So that is one tool that I would really like to highlight and encourage everyone to look through when you're researching programs. The next question that's gotten a lot of reacts here is, in preparing my ERAS application, I've noticed that many strong candidates have similar academic metrics. From your perspective, what qualities or experiences really make an applicant stand out during the review process?
I guess I can start. So, the things that we look for, I'm really interested in leadership capacity. So I love to see things, even if they're not neurology, because I know a lot of people come to neurology later, through their 3rd year clerkship or even, early in 4th year. So I don't hold it against you if you don't have a huge application full of neurology things, because it just may have not happened that early for you. But I love to see commitment to things longitudinally. So if you worked in a pediatric GI lab for 4 years, or you worked in the UR, free clinic for 4 years, or you were the OBGYN student interest group vice president, then secretary, or whatever, I really like to see that you took on leadership roles and kind of committed to something long term, because I think that says a lot about your character and how you're going to do as a resident. So those things always kind of stand out to me. And, I think I always read the personal statement. And I think that, again, is very subjective, but those really kind of speak to me. I'm not a big, we're losing. The step 1 is now pass fail. Step 2, I'm not really big on I just want to see you pass it, honestly. I don't have sharp cutoffs for any of those things, but I really like to see an application that puts you together as a cohesive applicant, and that you've kind of had a path and you've stayed, you've kind of forged that path, if that makes sense. So however you came to neurology is, I think is interesting, but I'm really interested in seeing how you kind of got from point A to point B. And if there were obstacles or challenges, I want to hear how you address those head on.
Yeah, that was very well said. I'd agree with pretty much all of that. I think one of the big things that I really look for in reading sort of the more subjective parts of an application, really the big question in the back of my mind is like, what makes you a real person outside of just a hospital robot? Like what kind of things are you actually interested in? What do you care about? So in that experiences section, I would strongly recommend that you write about the things that bring you joy, the things that are important to you, not the things that you think are important to us. You know what I mean? I think a lot of us can probably tell the difference. And I love reading about, somebody's high school and college marching band career, or like whatever. It can be completely unrelated to medicine, but but especially like Dr. Tomcik said, longitudinal experiences, leadership roles, things that are important to you. Please tell me about those are the things that I'm really interested in, because frankly we get a lot of applicants, and the vast majority of them have are successfully completing med school. So like, that's a pretty smart person. I believe that academically you have what it takes, right? It's show me the other parts of yourself.
Yeah, I'll echo that. I think if your application can really show sort of your genuine passion and, it's asking about meaningful experiences. So that's the whole idea, is that we want to know, you know, what you're excited about, what makes you tick. If you're a resident in our program, sort of what are you going to bring that's sort of unique or creative or have leadership potential? And it's not a certain one thing. I think programs are not looking to make sure that you've had neuroscience research for at least 3 months check. We're really looking at you as a whole person. And also make sure that when you're writing the experiences section, those are the topics that you are going to need to discuss in your interview. So it's really, that is what interviewers are looking at. Oftentimes that's the sheet that they're given when they're prepping to meet you. And that's where they're getting their topic ideas from. And so if we see something on your application, we're like, oh, wow, this person did X, Y, or Z. That sounds really cool. I want to know more about it. That's another reason why you should really describe things that you're passionate about, because if we ask about that in the interview, we can tell if it's something that you just kind of wanted to have something to list versus something you're really excited to tell us about, and what made that experience exciting for you. What did you learn for it, to talk about how you're going to bring whatever skills or knowledge to, forward in your career, all that good stuff.
All right, so for the next question, this is regarding personal statements. So what are your expectations when you read a personal statement, and what resonates the most with all of you? And I know you kind of touched a little bit on, what you want to hear from the application overall, but if you have specific thoughts on the personal statements, you can share them.
I can start with this one. I've talked to a lot of other program directors. I feel like my thoughts might be a little different than some other people's. Um, if I'm being honest, the vast majority of personal statements that I read are fine. Like, don't sweat over it. Most of them are fairly well written. There's few grammatical errors. They I believe that they have a genuine interest in neurology, but it's probably a pretty small percentage of them where I read it and this person has had some crazy life story that I'm like, wow, I need to meet this person. And then there's probably another very small percentage of them that I read where I question, are they literate? But everything in between to me is kind of fine. So I actually advise people to don't sweat it that much. Write it well and do a few drafts and have someone else look at it. Again, I fully understand that I might be alone in feeling this way, but I'm just being honest with how I see it.
No, I tend to agree. I think most of the personal, I mean, we get hundreds of applications every year, and I read every single one of them myself. Most of the time, if your personal statement stands out, it's not for a good reason. So, don't try to be, don't try to stand out. Don't try to be super creative. And again, don't tell me what you think I want to hear. I know you're able to use personal statements, like individualize them for programs. But I would just be very cautious. If you're applying to a lot of programs, it would not be hard for you to forget to take out University of Rochester and put in University of Connecticut and send them to the wrong people. Again, it's kind of like typos and spelling errors and grammatical, really just proofread it, make sure it is an accurate depiction of who you are, why you've chosen neurology, and what you're looking for as the next step in your training, ultimately in your career. If you don't know, that's okay too. But just don't overthink it. Just be authentic. Just put it out there in your usual voice and don't try to get fancy.
Yeah. So I've read so many essays. So I've been doing this a long time. I've been reviewing applications since I was a PGY3. It's over 20 years. So I can tell you that there's probably a handful of them every year that are super standouts for me. And the ones that are super standouts for me are, which obviously isn't very many of them, are ones that are just a really well written, just like like a really excellent piece of writing. And that is by no means the expectation for the personal statement, but there's usually a handful of them that are just so well written. Sometimes I'll read one and be like, okay, what did this person major in college? Okay, English literature. It's definitely going to be something that involved a lot of writing, or creative writing. So, and then the content of about a handful of them each year um, really is moving to me, and really leaves me wanting to talk more with that person. But that's only a few of them, and the rest of them are fine. I think unless you write something like really grammatically terrible or offensive, um, you know, that it's probably not going to weigh that much in our decision-making process. The other thing that I would recommend to not do, so a lot of people will choose to present an interesting patient in their essay. I want you to, if you're going to do that and discuss localization or, a diagnosis that a patient had that you saw, please make sure that it's accurate. You are sending this essay to people who have been practicing clinical neurology for decades. And so if you kind of mess up um, the case presentation, or write it in a way that really doesn't make sense. I mean, we're not expecting you to be neurologists yet, but I think that that's a little bit probably of a turnoff for most program directors to get something like that. So make sure if you're going to do that, maybe have somebody who's a mentor or somebody who's already a neurologist kind of look it over to make sure it looks okay, and that you are prepared to discuss that case in detail in your interview. So I'm not advising you against discussing a particular, patient case that you found really interesting or meaningful in your essay, but just make sure you do it accurately, and can talk about it. My favorite essay, because I get asked this a lot in this kind of thing, the past couple of years, and I won't embarrass who it is because they're still training with me, but I got the personal statement, and they wrote about their experience doing martial arts throughout their life, and that how meaningful it was for them once they had been doing it for a really long time and they were an adult to teach their father martial arts. And they wrote this brilliant essay about how education and teaching, and developing expertise over the years was so important to them. And I'm not doing it justice, but it was just such an amazing essay. And that's the one that's sort of most memorable to me in the last couple of years. And, this person ended up being just like as amazing a resident as I would expect from reading that essay.
Alrighty, thank you. Our next question, we want to address red flags. So if you guys could speak a little bit more on how can applicants address their red flags both in the application process and then also in the interview process.
I'll go. Um, so I think, I go through every facet of the application. So if there's a red flag, I will see it. So my advice is don't try to glaze it over. Don't try to hope we don't see it. Um, I love a good comeback story. I would like to know, if you had a failure in a course, or you failed one of the steps the first time, or you didn't do as well on your shelf exam for whatever rotation, or you didn't get into medical school the first time. I want to hear what you learned from that and what you brought to that and how you overcame that obstacle, or that challenge. And so if it's on there, it's going to come, it may come up. It doesn't mean that you won't get an interview, but if you get an interview, then it may come up and somebody may ask you about it. And just be prepared to talk about those things. But I would say just be very open and honest and direct about it. I always tell my residents progress, not perfection. We're not expecting all of you to be on a straight line. And we've all, I've been practicing for 20 years. It's not been like this. It's been a lot more like this, right from undergrad. So we fully expect that you have had challenges. And I think that's a lot of what makes you wonderful. So I say hit it head on, get after it, tell us what happened and how you overcame it. And that's what I want to hear.
Yeah, so in terms of red flags, I totally agree with all of that. It's important to kind of reflect on whatever, failure on the test or, sort of and be prepared to talk about really, I guess, your resilience and sort of how you change. So if it was having trouble academically, how are you able to turn it around, and really describe sort of your insight into that process and your reflection on it. And I think that's something that's really reassuring to programs. And it most often will be the program director that will be discussing something like that in the interview. And so that's, kind of sort of our role, in terms of when interviews come up and there's an issue to talk about. But yeah, I think also think about it this way. If there, a few people asked about this also, I saw in the chat, are there programs that might filter out based on a certain objective number? It's possible, but I don't know, if you have a program that does that, then maybe that's not the program for you, So I think holistic review is really important. And a single test day or a single grade in a single course should not sort of, affect your future trajectory in terms of, what you want, in terms of, obtaining your goals career-wise.
Yeah, I mean, I really have very little to add to that. I completely agree that the only other thing that I'll emphasize again is don't try to hide it, right? It's much better when it's addressed head on, I think. Now, whether that's in the experiences section in the personal statement, right? It's just somewhere in the application, if you failed one of those pre-clerkship courses and had to retake it, we will see that. Let us know. Let us know what you learned, and that's okay.
All right, so this next question is regarding applications from IMGs. So if you could kind of address how IMG friendly each of your programs are and whether you think there's an advantage to having step 3 results ready when the application opens, and any tips regarding giving a geographic preference or saying no preference indicated.
In terms of being IMG friendly, I don't know. I think, almost a third of our neurology residents are IMGs. So as a whole, the specialty is IMG friendly. If you look at a program specific website, you should be able to see there what the composition of their faculty and their residents are. And so if you're trying to figure out where you want to use your signals and where you want to apply, I think it's important. So, I know we have several DO facilitators, DO candidates. I think the same thing with DO candidates. If you go and look at a program website and you see that there are no DO residents in that program in the last 5 years, that might not be, your top choice. I think one of the things that's important, if a program really values diversity in terms of training pathways, it's important that you see that when you look at their composition of their residents and residency and their faculty. I can do step 3. I don't know that it matters that much. I think it might be helpful in the case if you have like a pretty low step 2 and are able to take step 3 and really get a good score. I mean, I feel like that would that probably looks good just sort of as a gestalt. It's kind of looking at the application, but it's by no means necessary. I think it's also helpful to get it done with if you can before you start PGY1. Super helpful to kind of get it out of the way and not have to worry about it once you start intern year.
Yeah, again, well said. I have very little to add to that.
Nor do I.
All right, maybe with this one, Dr. Dalrymple, we can start with you. Could all three of you talk about your most favorite part about your program?
Uh, so this is going to sound so cliched. I'm sorry, but I promise you it's true. It's the other people that are around me. I was in your shoes 11 years ago, I guess. 2014 was when I was applying for residency. I was couples matching. My wife is family medicine. Um, and we literally flew all over the country, interviewed at a bunch of different places, and pretty early on, I realized that everywhere that I was interviewing was going to train me well, right? And I think that's been said already that like the end of 4 years, I was going to be a competent general neurologist. So I really started judging places more on basically vibes. Like what was this a place that I could see myself going to, enjoying, learning? Did I like the people? Did I like the environment? And at UVA, I got there, the residents and their significant others outnumbered the applicants like 2 to 1 on the dinner the night before. They were all very clearly friends with one another. PGY 3 residents, significant others were talking with PGY 1 residents, and they clearly hung out outside of the hospital. On the actual interview day, the residents and attendings would like quickly see and make fun of one another. It was a very collegial environment. A lot of people were on first name basis, and I thrive in a place like that. Some people really thrive in a competitive cutthroat environment, but I like a place where everyone's on the same team. So I got to UVA and I realized that was not just a facade for interviews, right? I mean that's actually how it is, and now that I'm on this side of the curtain, so to speak, like that's not an accident. That's actually very intentional on our part from department chair on down. And so not only is that my favorite thing about it, but that's probably the biggest thing that I look for in applicants too, right? Is like, how are you going to continue this? Are you going to still be or are you going to come here and you're going to be a good team player, a good addition to this team as well?
So my favorite part, you stole my answer, but I'll give a quote from Dr. Emma Sciafalone. She's our associate chair for research. She is originally from Italy. She was giving a grand rounds recently in February, and someone mentioned that the climate in Rochester, New York, is slightly different than in Italy at that time of year. And she had the beautiful statement that, warmth is not about geography, it's about the people, and that Rochester has the warmest people in the world. And so definitely when you are walking the halls, when you are at Grand Rounds, when you are rounding, when we were at the zoo yesterday for our annual resident wellness day, it's just the camaraderie, it's the collegiality, it's the friendliness. And I think that really helps when we feel we have this personal connection to our residents. We really, really have that drive to help them succeed, and really want to take care of them both personally and professionally, however we can. And I think it just adds just a nice flavor. And residency is hard wherever you go, and you're going to be trained well, but you don't have to be miserable, even though it's hard. And if you can make those lifelong friends, and have those relationships last a lifetime with your mentors, with your fellow residents, I think that's huge. So.
Yeah, I mean, you spend more time with people at work, people that you do residency with, more waking hours than you do at your home generally. So it's really, really important. And I think that, we're all on the same page with that. It's really important that, my favorite part of what I do is spending time with the people that I work with. And one of the things that I'm really proud of, having done this so long, is that I can see kind of the success of the people that I've worked with, and kind of really just feel like, just so amazed and just proud of to see kind of how everybody's career has gone, to hear about people's growing families, to hear about their moves and things like that. And in terms of specifically where I work, a lot of the faculty, both at Hartford Hospital as well as UConn Health, which is our other site, a lot of them are my previous grads from the past 15 years. Including some people in leadership positions now and who are senior faculty. And so these are people that, were residents when I was a junior attending and just starting out as program director, and now one's an associate dean. Several of them are fellowship directors. Several of them are, in leadership roles within our program, and really love just working with the trainees and wanted to stay or wanted to come back because that was so important to them. So I think that's probably, I'll have to say, probably my favorite thing about our program.
Awesome. Thank you for sharing a little bit about each one of your programs. So this question is a little bit more of a specific question regarding ERAS. They want to know if you have a preference for how to format the experiences sections, whether bullets versus paragraphs makes a difference for the experiences.
I would say just having a brief description. We might not know by a bullet point what something is. And I think, like I said before, if you put like research in the something lab as an experience, just as a line item, we're not going to really understand what specifically about that. Why is that an experience you're choosing to list? So I think as somebody who, kind of put yourself in our shoes, I guess, put yourself in the shoes of somebody who's reviewing the application of someone we've never met. What are the best ways, like, when you fill out your application, the final product should be something that, like, when you hand it over, we should have like a great sense of your passion for neurology, all of your interests, how your path up till this point has gotten you here, and what your, kind of what your career goals or your future goals are, at least within residency training. You don't have to have picked like you want to do, a 2-year neurocritical care fellowship or something like that. But, just so that we kind of can get to know you the best way we can, sort of in that paper format or computer PDF format.
Yeah, and then just also try and be cautious of not explaining things too much. I think there's a word limit or character limit in the experiences section, but keep in mind that in addition to trying to read all these, we have a lot of other ones to read too. So I think try to be economical with word choice while still explaining everything to the extent that you see fit. I think when in doubt, explain a little bit more, but we have to read a lot of these too.
I agree with all of that. I think the other thing is you want to, when you're choosing what to highlight, just make sure that it really all fits together. So if you're saying in your personal statement, I really want to be a clinician scientist and I want to do clinical trials research, and if you're that far in your career ideas already, then that's wonderful for you. I am not, but if you then in your meaningful experiences there's no research, then that is kind of like, well, that doesn't make sense to us. Or if you say, I really want to be an educator, and then it's all research, then so I would just say when you're picking the meaningful experiences or the things that you want to highlight, just make sure that it is an authentic representation of who you are. And again, not like, well, I better put research there because, if they don't see that, then they're not going to take me. Just make sure that it all kind of fits together, because otherwise we just don't, at the end of reading your application, we just don't have a great sense of who you are. And that's not what you want. You want us to be very clear in who you are and what makes you tick. And so just make sure whatever you're putting out there is the right representation for you.
Alrighty, and now that we just have a few minutes left, panelists, thank you so much for joining us today. If all of you could just share one kind of piece of closing advice, some parting words for our participants here on our call today. And Dr. Tomcik, we can start with you.
Oh man, words of wisdom. I just said I don't know what to do with my career 20 years in. So, I would say, you know, just we want to know who you are. Don't panic. You are, you're meant for this. This is your path. And it may not be a straight line. But just be confident in your skills, confident in the qualities that you have brought you to this point, and continue to show those, whether it's in your application or your interview. And just, again, just enjoy the process because, it's very nerve-wracking, we know. But you're going to find the place where you belong. And so just know that at the end of this process, there'll be a lot of ups and downs, but it will bring you where you're meant to be.
Dr. Schuyler, would you like to go next?
Sure. So I guess my advice is similar, which is to, I know this is, you're probably anxious, you're probably having some stress, right? But to the best of your ability, try to enjoy the process. It's a really exciting time. This is like a huge step in your career. And when you get to the point that you're interviewing, it's a great opportunity for networking, right? So you're going to interview at a bunch of places. I hope all of you are going to interview at like all of your top places, right? So, and when you do that, you're only going to match one place, but you have this opportunity to meet residents, to meet faculty, to meet program directors, to meet department chairs from all of these amazing programs. And I think it's just a wonderful opportunity to kind of like meet these people and kind of get to know them. And so I would say do the best to enjoy that. And also to kind of network and meet, the residents at the different programs is probably, if not the most important thing you can do. Just to really see if, this is a place that we talk about vibe, but is this a place that you feel like you would fit, that seems like, a nice environment where you'd be able to grow and really spend a lot of time with the other residents and, just really take advantage of that. Most residents, when you interview at these programs, are going to be really excited to, field questions later, or if you want to talk later, of questions towards when your rank list is due. So really take advantage of that when you're making your decision. And my last piece of advice is just from, professionalism from start to finish. The program coordinators do such a heavy lift for recruitment. So the nicer you can be to the program coordinators in terms of scheduling your interviews, getting back to them promptly, being polite in every aspect of the process with them in particular, it's really going to pay off. The coordinators just do so much work in this. So I just wanted to recognize sort of them and make sure that, all of you remember that when you're kind of going through all this scheduling and all that good stuff. So, and I wish you all like the best of luck with it. I mean, like I said, seeing so many people in this meeting makes me so excited to, to start doing this. I love interviewing. I love reviewing applications. And so I'm getting pumped for next month. It's coming soon.
Yeah, that was great. I echo all that once again. I'm glad you brought up the professionalism and how important the coordinators are. I mean, really, without our coordinator, I'd be lost at sea. So take the time to answer the emails, right? Be nice in all your interactions. It's not just the program director you're trying to impress. And then my last kind of parting piece of advice, I don't claim to have any wisdom to bestow on you, but I think you've already made it pretty far. Like the fact that you're at this step means that you're a pretty accomplished human. You should be proud of that. Be confident in yourself. Like you've done a lot. You'll be a great neurologist one day. Whenever you do have those interviews, you were selected by those programs to interview there because they think that you would make a good resident, right? Again, I'll speak for myself, but we tend to get far more applications than we have interview spots. And so we offer interviews to those people who on paper we're like, this person seems like they'd be great. So know that, and you'll all do great.
Thank you so much for all of your encouraging words. I'm just going to share my screen one more time here for our closing slide. We're sure that you guys heard about this event probably through our social media, either through Instagram or Twitter. So go ahead and give us a follow if you want to keep up to date on all of our upcoming events. We actually have 2 more adult neurology panels this week on both Wednesday and Friday at the same time, 8 p.m. Eastern Standard Time. So please feel free to join us for those. Again, Dr. Dalrymple, Dr. Tomcik, and Dr. Schuyler, thank you so much for joining us today. This whole session is going to be recorded and uploaded to our YouTube channel, so feel free to check that out later as well. And that is all for tonight. Thank you, everyone.
Thanks for having us. Good luck. Take care,
Thank
everybody.
you. Good luck, everyone.
Thank you.